council.state.or.us. And that email address and more info about the council can be found on the Measure 110 OAC website. If you need any more information or support with community engagement, Brandy is the person you contact, Brandy Hemsley. All right, folks, good to see your faces again. Those of you on camera, appreciate you. Last week, you discussed the RFGP process with Angela, and you shared your ideas and concerns. And you also spent some time hearing from Colleen, one of the rules coordinators, and about what the timeline looks like for permanent rulemaking and some considerations for establishing channels for public input. Today, you'll go further with that work and dig into both of those issues and bodies of work again. All of your tri-chairs are here with us this week, and I believe Keisha is leading today's meeting. So Keisha, I'll turn it over to you to run through what folks should expect on the agenda for today and get us going. Thanks, Keisha.
Thank you. Welcome everyone to our September 22nd Measure 110 meeting. So we're gonna, Angela's gonna give us a Measure 10 weekly report. We're going to continue the RAC conversation. We're going to have an update on the grant subcommittee. I think Ron might be doing that one. Then we're going to go into executive session and come back, more to follow after executive session if we still have time to come back to the public meeting. And with that, Dr. Reginald has his hand up. He didn't get to introduce himself, I think, last week. So we're going to give him the floor for his introduction. Then we're going to turn it over to Angela. Thank you, guys.
Thank you. Good afternoon, everybody. I'm Dr. Reginald Richardson. I serve as the Executive Director of the Alcohol and Drug Policy Commission. And actually, pursuant to Senate Bill 755, the Alcohol and Drug Policy Commission has a seat on the council. And so we are formally taking our seat today, and we weren't recognized in the roll call, but I just want to make sure that we are aware that we are now a member of this council. So thank you for that opportunity, and I look forward to working with all of you.
Thank you, Dr. Richardson.
Thank you.
Thank you.
Now we're going to turn it over to Angela.
Okay, thank you, and welcome, Dr. Richardson. I have a considerable amount of information to share with you today.
Angela, before you dig in, will you just
Yes.
just for these beginning meetings for the next couple of weeks, just a quick intro, like your
Yes,
role?
of
Thank
course.
you. Thank you.
My name is Angela Carter, and I am the program manager for Measure 110. I started about a month ago, and I'll be visiting you all in the meetings and sharing information with you on a pretty regular basis. So, hello, nice to see you all. Thanks for giving me a moment of your time to give you some updates. Okay, so for starters today, I wanted to just let you know for logistical purposes that Sabrina will have a new phone and email beginning September 24th. We're going to be getting that information and updating, but just to let you know, if you need to contact her, there'll be a transition to new contact information. I also wanted to let you know we have several new team members with Measure 110, and I wanted to give them each a chance to briefly introduce themselves. We have Jessica Carroll, Anelia Hawa, and Walter Bailey. Jessica, would you mind giving just a brief hello and let people see your face and hear your voice?
Yeah, thank you, Angela. Hello, everyone. My name is Jessica Carroll. I am the new Measure 110 implementation lead, and I'm super excited for the work we have ahead of us.
Thank you. Okay, and Anelia, how would you mind going?
Hey everybody, I've seen most of your faces as I've been watching the YouTube videos online. I am the new Measure 110 Operations and Policy Analyst, and I am first generation, half Cuban, half Lebanese, and I'm also an epidemiology graduate student.
Thank you. And last but not least is Walter Bailey. Oh, we can't hear you. There you go. You got it.
Hi, everyone. I'm one of the newest members to the Measure 110 Council. I am Operations and Policy Analyst 2. So very excited to be a part of this team and look forward to working with you all. Thank you.
Thank you, everyone. All right. So next up is a brief overview of what's going on with the Access to Care grants. So there were 36 total awards. At this point, we have 11 fully executed. 23 of them are sitting with the grantees waiting for signatures. One is with the DOJ for final approval, and one is on hold. At this point, there's data that has been collected back in the form of reports from 12 or so of the orgs who received grants. At some point, and I'll discuss this with the tri-chairs for a future meeting, we'd love to have some of your time to share some of the report information. This week and last, we have started working with the committee of the OAC, creating the Behavioral Health Resource Network's requests for grant proposals. So we started on the 20th, we worked again on it today, and then we'll have another meeting early next week to bring the RFP to its final iteration and then bring it to the council next Wednesday for approval. The goal is to get this RFP launched by October 1st. We're also beginning the planning process for a webinar to give information to the community about the grants and the granting process, which hopefully will occur about a week after the RFP is published. The webinar is going to be both informational and also provide an opportunity for the organizations seeking the grant to connect and collaborate with each other in county-specific and area-specific breakout rooms. There are some questions for the council to consider for final consideration on the RFP. One is to make a final determination on whether this will be a grant or contracts process. After you speak today with Allison, clarifying funding priorities for the burns is another question. And then the committee, the RFP committee, will be determining what rules need to be changed by 10/1 to guide the burns appropriately. I have a few more introductions to make. We have a tentative rules-making team pending approval. There are 3 folks to introduce. First is Hannah Christensen. Hannah, are you with us today?
Yep, I am here. How is everybody? Hope you're all doing well.
Welcome. And
Thank you so much.
And then we have Nida Kumar. Nida, are you with us?
Yes, hopefully you can hear me.
Yes, we can.
Just figuring out technology. Hello, my name's Nita. I've silently watched at a couple of meetings already, and I'm working on, thank you, Angela Carter, for meeting with us so many times and being a really great in-between, and kind of, as you had mentioned, tentatively, we are kind of restructuring on our end, and Hannah is amazing, but is also in training. So I know it sounds like there's a lot of us, but it will eventually just be one. But I am here for support and for training. And if I'd known I was going to be live, I would not have worn the cow polka dot dress.
Love the dress. It's fantastic. And then our final rules team member, again, last but not least, is Sam Byers, who's going to be managing the behavioral health part of the team. Sam, are you with us?
I am. Hello, everyone. I'm just here to say hi, and that myself and the team that you just met will continue to guide you through making adjustments to the temporary rules and also finalize the permanent rules with you, which is very exciting. Thanks.
Thank you. So hopefully, ideally, if possible, it will be ideal to get the rules finished by the beginning of the year so that the Burns are able to use them as guidance moving forward.
Angela, we have a question from Ron.
Yes, Ron, please go ahead.
Yeah, I was just curious. You mentioned that I think you said Sam would be focused on the behavioral health aspect of the rules. What would the other people be working on? I was confused by that.
Do you each have a sense of your what your lane is going to be for this process? I see a couple of hands. Maybe Sam, do you have?
Yeah, in response to that question, Sam, do you have a response to that one?
My apologies. I'm raising my hand and raising my hand electronically there. Yes, so the rules coordination is falling underneath a unit that I'll be managing. And I think as it relates to the council's work, it will sit with myself and Hannah and Nita. So the team that you met will be supporting your work and making sure that it processes in the way that you want it and in a timely manner. Just in terms of rules in general, and actually I think Colleen and her team will best speak to it. I think we distinguish behavioral health just because public health has rules, licensing and certification does. So we have these distinctions so we understand kind of where our focus is and that we keep our expertise where it belongs. But for the purpose of the council, we'll continue to support you as we did previously.
Thank you for that clarification. Appreciate it.
Thank you. Yes. And Sabrina, I see your hand up.
Yes, I just wanted to ask you, did you say when the webinar might be?
It should be within about a week of posting the RFP. I want to give enough time for the community to see the RFP, get started thinking about it, and then get them in to meet each other and get more information.
And then also I had a question about the update when you said one was put on hold. I was wondering if you could share why, or if you could let us know later.
I can let you know later. I don't have a great deal of details on that. I just know that currently it is on hold.
Thank you.
Yeah, I'll let you know what I can later.
Yeah, it'd be great to get a written report on the status of our access to care grant, the 1921 access to care grant. I want to check the math on that. I think you said 30 organizations or something like that?
36 were, 36, from my understanding, 36 were funded.
Because I'm operating with a different set of numbers. That's why I would have.
Okay.
I thought it was more like 70 organizations, $30 million, 15 different rural counties, 5 metro counties, and so on and so on. So anyway, that's why I wanted in writing so I could check the math.
I will double check on it and make sure that I'm giving you the right information. I see your hand, Blue.
Yeah, Angela, I'm not sure if this is directed at you or if this is somebody else, but I have been getting a lot of feedback from the community that it would be really helpful to update our website to have some of these even tentative dates going up, as well as the date that we're opening up applications on October 1st, just so there's somewhere to direct people, even if the information is limited, so that, again, if somebody's not directly connected to the council, they may, without watching all of these meetings, they may not be able to figure out when some of these dates are and what the process looks like so far.
Okay, I will do what I can to assure that that happens. Any more questions before I move into the rest of the information? Okay, just a couple more points. I wanted to let you all know about the evaluation and metrics stakeholder group. Julia Dilley, who is an epidemiologist from Multnomah County Health Department, is heading up an evaluation stakeholders work group to decide what data needs to be gathered and analyzed by the Burns and other state agencies to assess the Measure 110 program's efficacy. Those meetings are going to begin on October 8th and run through October and November. And there are 4 Oversight and Accountability Council members in the group. If you would like a more thorough list of who is in the group, please email me and let me know, and I'll happily let you know. And then I just wanted to give a couple of flags for things that are coming up soon. There is a 3rd wave of access to care funding that will be going out somewhat in parallel with the granting for the Burns. So we have the RFP from the initial granting process, and we have the initial process that was used, but there may be some modifications to that RFP and to that process that you all would like to make based on recommendations from community and recommendations from staff. It may be that the council will need to make another committee to do this work. I just wanted to put the idea out to you and let you decide on what you would like to do to prepare for and get moving on that set of grants. There's also the review of these grant applications. So we're going to get back all the burn applications by November 15th and access to care grant applications by shortly thereafter. And we'll need somebody who wants to review these. So that could be another committee for the OAC. Again, I'll leave it up to you to decide, but wanted to put that question to you of how you would like to go about reviewing the grant applications and scoring them. And then the last piece, no, there's 2 more, sorry. The final rules, like I mentioned, ideally would be ready by the beginning of January so the Burns know what is expected of them. That could be another committee meeting. This is a lot of committees, but I just wanted to let you know what's coming up. And then finally, there's a recommendation, there's a suggestion that the Burns will need to develop policies detailing how they are going to assure that they meet the standards of service outlined in 755. And so it was recommended that the OAC, in concert with the OHA, develop a basic set of policies to share with the Burns so that they have a sense of what the baseline requirements would be. They could then add to those policies if their services are beyond the basic requirements. So is that another committee? How would you like to do that work? And that is all that I have to offer today. Thank you for your patience, and any questions before I pass it back over?
A couple hands here, Angela. Sabrina and then Ron. Go ahead, Sabrina.
Yes, in reference to the access to care grants, is that the original access to care grants along with the RFP funding, or is that a 3rd one? I just wanted to make sure that I heard you correctly, or is it just the 2 or the 3?
This is the number 3 in 3rd wave in the grants of access to care.
Okay.
So you did 1 in April. You did kind of a 2nd wave, July-ish. This will be the 3rd one.
Yeah, the way I'm separating these in my mind is there was the period was the 1921 our access to care grants, and now we're moving into the 21 to 23 access to care grants.
Exactly.
So, and just for my clarity, the way that you just kind of framed it, I just want to kind of put it the way I understand it, which is that the law requires that we establish the burn funding must be established first. And so that's what we're doing now. Then immediately following the creation of the burn grant, we're going to then move to begin the process for the access to care grant. So there's only a couple weeks separating. And so it can be, in my mind, it could be the same committee. I mean, we're having different people coming to these committees. As long as the committee is up and running continuously through the burn grants or contracts and the access to care grants or contracts for the 21-23 cycle, I think we're good.
Okay, so any last questions? And I'll also say I have to go to another meeting, unfortunately, today. But Jessica Carroll will be here taking notes. And if you have any questions that you would like to ask of me, you can pass those questions to Jessica and she'll convey them to me so that I can get back to you.
Thank you. Ron, your hand was up from before. Did you have anything else?
No, that was it.
Okay, great. Thank you, Angela. Go ahead,
Thank
Keisha.
you.
I was thanking Angela, and for the next portion, for the continuation of the RAC conversation, I'm gonna turn it over to my fellow Chai Chair, Ron.
Yeah, hi, everybody. So last week, we heard from Colleen, who talked in great detail about the RAC and the ways of approaching the RAC and options for establishing the RAC, and kind of where we landed, as I understand it, was that we had started talking about identifying categories or different buckets of kind of entities, organizations, sectors that we think should be included. And so my hope today is that we would be able to create kind of those buckets and then begin naming names. And so from a process or legal perspective, I just want to make sure that it's totally and completely appropriate for us to actually begin naming names of people in specific organizations once we identify those buckets. So if that's legit, those are the two things. So in terms of buckets for me, I mean, we could just open it up. I mean, I have some, but I'll just open it up to kind of what sectors, organizational entities should we be trying to include, or should we want to include? Like I could say treatment providers as a bucket, and from that bucket, who would we want? I could say policy advocacy, and that's a bucket. I could say harm reduction, rural communities. And we would then begin to identify folks that you feel, if we can identify those buckets, we can create a list of buckets and then identify people under those buckets. That's the way I'm proposing we move forward. So that's, I'm proposing that to the council to now deliberate, and I'm going to be quiet.
All right, Karen, go ahead.
Yeah, I had sent Brandy, based on last time we had this discussion, I sent Brandy a list of entities that I thought should be represented, and then I did suggest some names. I don't know if you want me to kind of go down the list or just share it in the chat, or
Brandy, are you able to like put like create a document that we can all work from on the share screen that has buckets and names?
Yes, I can do that. I have a list of people who've reached out. I'm not sure how many of them, I don't know if you necessarily want me to share that right now, but I could create a document that has the buckets so we could work on that. So
Yes.
Just give me 1 second.
And I'm gonna like to know who reached out too.
Right, because it's interesting that we have a list. I was going to get to that next. Brandy's received some names. Karen's, other people have submitted names. So it'd be interesting to see once we have the buckets, who's already, what is the size of the list that we are currently operating from? Because at some point, I think it could get on. I mean, I'm not putting any conditions on it. I'm just saying that at some point we're going to have to consider size.
and just to finish, my list isn't like a, end all be all, because there's also, of course, somebody from the A&D Policy Commission. There's other people. I knew we'd have a discussion about this. Mine was just from the top of my head. Here's what I think. Thanks.
Sorry for interrupting you, Karen.
No, you're fine.
Any thoughts to share on process or responses to Ron's prompt? Go ahead, Blue.
I had thought that I had mentioned this in the last meeting, but about being able to open this up to the public or open it up in a way rather than us referring only our friends or our colleagues, that we really open it up and create some equity and make sure that we are getting people from across the state, not just people that we know directly. I think that would be, we can have some of both, but I think that there should be an opportunity for anyone to be able, who wants to give input. And I think we also had mentioned maybe at the public forums or something, finding a way to engage some of the people that might come to those for public comment as well. So I just, I would like to see at least a small portion available for people that maybe don't know any of us on the council.
I agree.
Thank you, Blue. Go ahead, Amy, and then Henry.
So when you said that a bucket of treatment for riders, is that what you were talking about, Ron or Karen? Is that?
I don't remember saying bucket, but I think what
I'm just saying categories. When I say bucket,
Right,
I mean
a category. So treatment providers, are we talking residential treatment or just
It's up to the
outpatient,
council.
i.e. residential?
It's up to the council. I'm sure they're going to have an interest.
Because I know that, because I know of one facility that has no idea that they could even apply for a grant with us, and so I want to make sure that they're getting the information as well. These other little, treatment centers. So that's kind of where I just want to be sure that they're being included in the information and how to get on that bucket, how to get on that list, or how does that work? That was my question.
You name them.
Okay. In the chat or on here?
I think we're open to names.
Where you're comfortable, Amy. If you're comfortable putting it in the chat, it's up to you if you'd like to.
There's a couple. So there's Eastern Oregon Alcoholism Foundation. It's formerly known as, now it's Eastern Oregon Recovery Center, and that's in Pendleton, Oregon. And then there's Redemption Life Services. They are also getting ready to build a treatment center that will, and they'll be able to provide treatment services to an underserved population. So, I mean, it's huge, but both of these need to be put on the list, please.
Thank you, Amy. Henry?
So can I check with Colleen about something? Colleen, do we want individuals and organizations or both?
So that's an excellent question. So we eventually want to be able to invite either a person if we know them. I appreciate Blue's comments about it always being a friend or a contact that we have. So if we don't have a contact, but we have a facility or an institution that we want to invite, we can, start there and say, hey, you represent somebody or an affiliation that we definitely want here, and we want your perspective. We don't know anyone, so can you send someone on your behalf? Or we could even say, hey, we know Cindy Lou can, I heard Cindy Lou is unavailable. Can you send someone, that can represent your facility? And then can I add something? My brain works in lists and I'm such a visual person. Can I offer assistance to write down these buckets or
yes,
facility centers? And then would it be all right with the council if I share my screen so that I could be kind of a note taker of sorts?
Yes.
So everybody can kind of see as we're going. Is that all right?
So Colleen, do you, because Ron had
Randy had
just
started it, yeah.
Yeah, do you
okay,
either,
then go ahead and share. I was trying to take notes while people were talking.
well, if you want me to share what I have in the chat, if you would want to take over, but I have it here. Either way, I'll show you what I have. We'll start.
All right, Brandy, we'll go with your notes. I'm glad multiple people are taking notes to capture the information, though. That's always helpful. Henry, go ahead.
Hey, good afternoon. Thanks. Yeah, I would just want to reiterate what Blue had already suggested regarding trying to elicit, community feedback. I think that's what my understanding what an REC is for, is to help to elicit the voices of folks who are most impacted by the work that we're doing and the policy changes we're making or the services we're trying to develop. So I want to make sure that we're trying to focus on those people. I had a couple other thoughts, but right now I'm kind of forgetting them. Thanks.
All right, thanks, Henry. Dharma?
I have two suggestions. I think that we need someone that's focused on youth, adolescent, and young adult services or programs. But someone that comes to mind is Pam Pierce, who's done a lot of work around the state with youth program development. I think they might still be with Community Living Above. Or folks from the Oregon Prevention Coalition working in the collegiate recovery programs and working with the recovery high schools. I also think that the Portland People's Outreach Project, since they serve so many folks, would be an important voice to bring in here to the RAC as well. That's it.
Would that be on a, okay, so we created a, I'm sorry.
Ron, did you have a follow-up for Dharma?
No, I was trying to separate buckets from invites, I guess. And so I saw P-POP as being harm reduction. Am I wrong about that?
I think they would fall under that bucket
Okay.
if we were to categorize them.
Yeah.
And you were calling out youth and young people as well, right, Dharma, as a bucket you hadn't heard?
Yeah, is either a bucket and then as a specific person, Pam Pierce as well.
Thank you.
And under youth, I would also, as a person, I would recommend Molly Rogers. For youth.
All right. Thank you. Karen?
Yeah, I have a few names to throw out. And I think two names, this would be young adults and maybe youth too, but Tony Veniza from 3D, 4D Recovery. He's been here to talk to us. And then Brent Canode. He's also affiliated with the high school recovery school movement. The Association of Community Mental Health Programs discussed this according to the notes that I read from their strategic planning session last week, and Aaron Grigg, and it's AARONGRIGG. He's interested in being on the RAC, and he is a community mental health program director in Union County, or rural frontier county. And the other name that I was going to throw out is a tribal program, Yellowhawk Tribal Health Center, and it's Shane, SHAYNE, Art, ARNDT, from Yellowhawk.
Okay, Karen.
Oh, in terms of
Aowen had a
okay.
I'm sorry. Aowen had a have been having her hand up. I don't know if she's still having technical difficulties, but she has a question in the chat that is probably very important.
Aowen, we're not able to hear you. I'm not sure if you're trying to address the group. I see you're off mute. Okay, I can read Aowen's comments from the chat. Having audio problems, would like to discuss process before specific people and organizations. Are we going to brainstorm now and then have an open process? It seems essential, and I don't think we can reasonably discuss specific people without having this guarantee of inclusion, or at least a bit more inclusion. to some of what Blue has raised already. Any more thoughts on that concern raised by AON and Blue?
I think Ron's hand's up though. Did you want to say something, Ron, before me?
Sorry, I was continuing on in terms of buckets and recommendations, and I was going to start to talk about culturally specific organizations like Miracles Club.
So before we push past the concerns, I want to make sure there's room for folks to address that so that you could decide as a group if you want to leave it alone and continue on the process that you've started on, or if you want to craft a more inclusive process that addresses the concerns Blue and AON raised specifically.
Yeah, and I agree with both of them too. And I'm just wondering, about the process and if we need to have a separate like systems coordination subgroup or something with all the orgs that need to make these rules work, but really getting what does and doesn't work from the most impacted folks.
Keisha, you also raised in the chat 51%. Do you want to talk about your concerns about representation?
Yeah, and I was just wondering, did we have some type of guide or criteria? Is it going to be 51% with lived experience or most impacted by the war on drugs or what? I mean, because it's nothing about us without us, and I think that voice should be louder than any other voice.
I think that we had discussed something in the last executive session with regards to that, Keisha. I'd like to talk about that more in the executive session later too.
Okay, thank you, Dharma. Ron, is your hand up, and then Henry?
No, I think my hand is still up from before because I keep it. So my question, so when I began this conversation, I kind of offered that we create the process. So whatever process we want to establish, that's up to us. So if we want to, create a process for having marginalized folks be a part of this process who aren't likely to kind of normally be in these conversations, I think that's great. But I think we also need to consider kind of industry interested people, because they're going to have an interest and they are impacted. So for me, it's both. And secondary to that, Brandy has a kind of community engagement strategy that she will be presenting that kind of gets to some of the question of if you're not plugged in and you want to plug in and engage with this rulemaking process or understand kind of what we're doing through community engagement. She has a kind of an outreach and engagement strategy that she wants to put forward, and she's ready to go.
Okay, thank you, Ron. Henry?
Yeah, I just want to note that, some folks some folks in the recovering community want to keep their names anonymous. So I think the process of just, saying people's names that we know might not be respecting people's, autonomy or anonymity or, confidentiality and whatnot. So I think it's helpful for us as a committee to also provide those people the opportunity to reach out of their own accord. If we're naming names and we're talking about people who I think there's a lot of people that meet a lot of those buckets around being people who have lived experience, who are also, providing services to folks. I have a friend of mine that's a recovery mentor. She's given me the 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 permission to say her name in a public forum. So Kendall Francis Burns is a recovery mentor that's worked for NARA and Fourth Dimension and has, provides services to both adults and youth in the foster care system. It'd be a wonderful, addition to the RAC, and is excited to help participate in that process. So I think, I don't know, maybe more allowing people to engage themselves and self-select and helping us to support that process, if that makes any sense. Thank you.
Thank you, Henry. Keisha has also dropped a name in the chat.
So I've received inquiries of interest from Fernando Pena of the Northwest Instituto Latino, Larry Turner of Fresh Out Community-Based Services, Julia Mines of the Miracles Club, and those are the culturally specific providers. I would also suggest, so those are the culturally specific providers specifically that I would put forward that have expressed interest already.
Go ahead, Sabrina.
Yes, I did have a couple of females that reached out to me as well that are, I believe, in the rural counties that wanted to put their name on the list now. And I did forward those to Brandy, but one was June Sue and Megan Torres. And so I just wanted to throw that out there while we're doing that.
Thank you, Sabrina. Blue?
I'm just a little confused on who to even suggest without understanding clearly what the categories or the buckets are. I don't know if anybody else is struggling with that, but for me, it's a little confusing to just throw out names without maybe understanding, being clear on what types of people or categories of people we're going to have on the rack.
Blue, would it be helpful to look at the notes from what Brandy is capturing and pay special attention to the buckets that have been identified?
Have we opened it up so that people can identify buckets? I guess that's where I haven't
Yeah, that's been ongoing. Yep. Yes.
Okay.
Yes.
It's very confusing. So people who actively use drugs, I would like included.
And Amy in the chat is agreeing with you, Blue.
Me too. I'm just wondering if we can, I guess, visually, like under the buckets, we're putting these names like youth, harm reduction, treatment, because the way it's written now, you can't really visually compartmentalize where everybody's going and what's not covered.
No pressure, Brandy. Thank you for doing this in real time. It's very challenging. We appreciate you. So thoughts, Blue is steering the conversation toward the bigger categories. And so any thoughts specifically around what should be included, what you see is missing from the list would be helpful at this time.
I would probably add policy advocacy folks. Tara Hurst of HJRA would be a good
Well,
example.
hold on with the names. Let's stick to the buckets for now. And then we'll continue with the names in a second as requested. And giving Brandy a second to type those up. Go ahead, Henry.
Yeah, I think I want to just express my curiosity or question about the limitations of, I think it's helpful, it can be helpful to attempt to categorize this stuff. I also want to suggest that there are many providers who do multiple things. or many folks who, we've named who do multiple things, like whether it's working with adults and families or doing harm reduction as a part of being a, treatment provider, and then also being someone that experiences addiction. So I think sometimes people have multiple, just like people have multiple identities, they might have also multiple ways that they work with folks who are either actively using or attempting not to use. I don't know if that makes sense. Thank you.
Like sectionality. Yeah. I can't say that word.
That was the word.
Yeah, you did it, and we all know what you meant, so thank you. Yeah. Any other thoughts on the buckets as Brandy works to organize those notes and organize your thoughts?
Yeah, I wanted to add the bucket, policy advocacy experts. And I also wanted to, under culturally specific treatment programs, I would just say programs as opposed to treatment programs. Some of them are doing, housing and peers, but not necessarily treatment. The word treatment is the problem. Thank you.
I think we need them both.
No, I think we do.
Go ahead, Karen.
I don't have a name, but somebody that works in the housing space, especially transitional permanent supportive housing and transitional housing.
Dr. Richardson?
What about parents who have child welfare involvement?
Thank you, Sabrina.
I was wondering if we have anybody that works in the hospitals up there.
What do you mean by up there, Sabrina?
Like up on the paper, on the thing that Brandy's creating.
Oh, gotcha. Okay. So could you say more about that group that you're thinking?
Yes, I'm just gonna read it as I got it. It says, for service for rural hospitals that service people, like peer support services for drug and alcohol crisis, that kind of situation. Like peer supports in the hospitals in rural counties.
Got it. Thanks for the clarification.
So are you referring to the Prime and Prime Plus program specifically?
Yes.
Go ahead, Ron.
No, I was just gonna, under policy advocacy, I was gonna add two names, Tara Hurst of the Health Justice Recovery Alliance and Mara Roach of the Partnership for Safety and Justice.
You are bound and determined to name names today, Ron. I'm seeing that, I'm hearing that. Bound and determined. And I see Keisha is also throwing up names in the chat as well.
Yeah, I'm just wondering, are we, have we been set on an outcome for this, or it just seems like it can go 1,000 different directions if we don't have like a set outcome of what we want to come out of this process.
There are a couple hands raised, and I'm gonna call on Steve. Steve, if you're available to weigh in on the process and the approach, if you could give us a little insight into what you're thinking, please, to put you on the spot. Okay, I'll call on Steve again in a little bit. Go ahead, Ron.
I was gonna say as I mean, the thing to, I mean, and Colleen can really speak to this more than I can, but in terms of kind of what is the role of the Rules Advisory Committee, you know, and it's advisory, and they're going to look at the temporary rules as I understand it, and they're going to make suggestions and recommendations. However, it's completely and totally up to the council whether to accept those recommendations, as I understand it. Colleen, is that correct?
Yeah, thanks, Ron. That's exactly correct. And I'm gonna second what Hannah said. There's no wrong way to go about creating RAC member lists. You guys are doing this for the very first time. So some people do it with buckets and they start there and they fill in contact names like you're doing. And then they step back for a second and look at holes and then say, oh, we need more people with lived experience. We need more people that maybe we just don't know. But to keep in mind that the idea is to think about, and I think you all are, who is affected by these rules, and exactly what Ron said, those people will come together as a rule advisory being the key, right? Committee to advise you as a council who owns the rules, right? These are your rules. And so I think what is also good to keep in mind is that we're not going to get it perfect the first time. We're going to probably develop a RAC. There's going to be people who aren't able to join at the time that we need them to move our rules forward on the calendar that we need. So we're going to miss some people there. And then we're also just going to think of people after. You know, you're going to run through this whole first time rulemaking process. And then the next time go, oh, if I would have known, you know, so just keep that in mind too. And you're going to present these temporary rules, the RAC members, which hopefully isn't going to be hundreds of people, right? Even though Ron has lots and lots of people on the list, which I love that you guys have contacts. Those people also have the ability to comment through the formal just public comment period as a member of the public who's interested, and even beyond, you know, just advising the RAC members. So say you have an individual, picking just one name, I'm looking, Aaron Grigg is on the RAC. Maybe I know Aaron and I can reach out to that person and say, hey, can you make sure when you're going to this RAC that you're saying this information and sharing this, and this is my perspective as well. So just because we're picking certain individuals or only certain individuals are able to come, it doesn't mean that that's the end all of the representation here at this particular RAC. There'll be more RACs to come and we'll learn too. So yeah, does that answer your question, Ron?
Yeah.
Yeah. Oh, and then to second that yes, once they have a RAC version where they say, oh, you know, you presented the temp rules to us, Allison has had her legal review, the RAC has had their legal review, it all comes back to you guys as the council to say, okay, what do we want to take and what do we not want to take? What did we hear from the RAC themselves? And so then you get to move forward with that new version as your permanent that we'll adopt for the new year.
Thank you, Colleen. Blue, go ahead.
I was just thinking about a couple pots that I don't see, although they totally could be on there. So if these are repeats, I apologize. A rural service provider, I only saw that designation near CCO, but I think somebody who is not like an actual CCO, but maybe just a service provider from a rural area. Somebody that serves the LGBTQ+ community. That's a really important voice or bucket to have. And I had one more, but I forgot it. So I guess that's it.
That's all right, Blue. You could always drop it in the chat too. Sabrina, go ahead.
Yeah, I don't know. Somebody that I put on the list would like me to remove their name off the list and keep one of the other ones on instead. They rather have the other person advocate for what they're doing in their work. And they have more information about what they're in alignment with, more than just Prime Plus. So I don't know if that's the time to address it, but I just wanted to throw that out there.
Sorry, I was muted. Thanks, Sabrina. We can follow up either offline or through the chat for that,
Okay.
those details. Blue, did you have more?
Just to make sure that we're including at least one provider that provides services to the tribes specifically. I know things can work a lot differently for tribal members, so I just want to make sure that that's included as a bucket.
All right, great. Thank you. Ron, I don't see any more hands with names or buckets at the moment. Where would you like to take this?
Okay, I think so. I think that's kind of what we wanted to accomplish today. I think we can continue to take names and then, and because there are a lot of, maybe share this out with folks to provide names, put a deadline on it or a time that we want the names to be finished. And in terms of process, I don't know if we need to accept the names or vote on the names or just have a list that we can just give to Colleen to get out to people, or however we're going to do the outreach and invitations. We'd have to talk to specifically what that is, but today we just wanted to get the process going of identifying the categories and beginning to name names.
All right, Dharma has a quick point. Go ahead, Dharma, before we transition to the next item.
I just wanted to make sure the last recommendations I threw in the chat got onto that list, either like with the LGBTQ care, maybe someone from Q Center. Also, Hazelden has some specific LGBTQ plus program providers. And I know Keisha had thrown in one as well, Aaron Waters. I also think it'd be important, maybe with regards to that bucket, to include an HIV or an infectious disease provider, either Cascade AIDS Project or HIV Alliance. But I think HIV Alliance serves more of the state.
And I put in a chat a name under housing, Mercedes Elizalde of Central City Concern, was the housing expert, housing and housing support. I put that in the chat. I don't know if you saw it, Brandy.
Yeah, I'm busy copying things from the chat now.
Okay.
And Dharma, who was that second provider you said? You said HIV Alliance and another that was kind of regional. Who was that?
Cascade AIDS Project.
Okay, thank you.
So I think what we'll do is that we'll clean this up with the staff, and then the tri-chairs will talk about it on Friday, is how we want to move forward with a list next week in terms of, do we want to put it to a vote? Do we want to just hand it over to the folks at and rules, Colleen and her folks, or do we want, how do we want to carry on? We'll kind of, does anyone have any comment or ideas about how they'd like to do it?
I'm just wondering, I didn't see any hands, how we can get this communication out to folks that we're not even touching right now, that are affected by or will be affected by this rule. I don't know. I know we have, like, depending on the RAC, we have like mass email serves for different categories or whatever, but I'm just wondering how we can get this out and not keep it limited to these few people. I mean, we have a whole state to cover.
There's a suggestion by Colleen in the chat to add something to the website or newsletter asking for any interest in the RAC. And also Brandy will touch on engagement as well, and some of that could be included in this. Not necessarily today, but as a point to come back to.
And the provider directory as well, just in addition to regular folks.
And Zeb mentioned in the chat, and I'm guessing, assuming that others have the same concern, that he would like to check in with some folks he has in mind to make sure that, you know, get their permission before he would put their names out there. So I'm thinking he's not the only one who's situated that way.
So Colleen, when would we have to kind of finalize this process of deciding who to invite?
Yeah, that's a great question, and I'm going to see if Nita has the copy of the calendar, the timeline that we did for the rules coordination for this thing to get it in order by January or February. I want to make sure we're on track so that we have, I think we were thinking our RAC meeting itself would be in October. So that would mean that ideally, whatever date in October we select for the actual RAC meeting, 2 weeks before that, we've given them a copy of the text, statement of need and fiscal impact, which I can get into probably next meeting if we want to talk more about what these things are, more details about them. And then obviously that means kind of by the end of this month having that list. So I don't want to put pressure too much on us, but can we start thinking about how we can get people selected in some way that you guys feel comfortable with next week or by the end of next week, even if that's not the council meeting itself? And otherwise, Nita, oh good, Nita, thank you. She just chatted me the timeline, so I'm just pulling it up slowly. Date in here. Yeah, so we have to send out the Dear Tribal Letter Leader. Okay. I don't think I'm ready to talk about all that yet. So
Okay.
wait, sorry. Yeah, I don't want to derail this part of the conversation, but yeah, be thinking about next week, maybe thinking about how we can come up with what feels like comfortable representation of these rules for the entire state, which is hard, right? Again, we kind of mentioned at our last meeting, the entire state. So thinking population-wise, all ethnicities and groups and ages and statuses is hard. It's hard. And usually the advice Secretary of State gives is 7 to 9 individuals, which seems drastically low, right? How do 7 to 9 people represent all of these groups and all of these people across Oregon? So be contemplating, and then let me know if you have questions about how to narrow it down. And it doesn't have to be perfect, right? Remember, this is just an advisory sampling of who might be affected. It doesn't have to be the end all.
Okay, but so we can finish this next week and we'd be fine.
Yeah.
Okay.
Yes.
Okay, well, thank you very much. And now I'm going to send it back to Keisha.
To send it right back to you for the
All right.
subcommittee update.
So the idea now is that there are a couple of questions that we had for DOJ and our council, and so as a result of that, we're going to be going into executive session. There's something that I'm going to read first about that. Yep.
Before you do that, on the
I
agenda,
can do
we have,
that part too. I thought
Okay.
you were giving
You
a
got the language?
subcommittee update. Yeah.
Okay, go ahead.
on the agenda, we have the update on grant subcommittee process as next before executive
Oh, I
session.
thought that. Sorry.
No, that's okay. And is that you, Ron, for the subcommittee process?
Well, I think we pretty much got the update today from earlier. The only, and I don't have access to, do I? I may have access to their documents, but but I don't think I can share, right? Oh no, I could, but. So what I was gonna just kind of start to lift up was the, so Angela talked about the fact that we met yesterday, Monday, and we met today. It's a grant subcommittee. We walked through a lot of the intro language. We added some language. We modified some language. We're going to kind of talk through some of that today. But we're going to meet again. I mean, I don't know how valuable it is to kind of talk about kind of what we've done. Is that what you folks want to hear? Because I would have to look up those documents and find them. Oh, here they are. This may or may not have I don't have the updated language with the with the changes. But let me just go ahead and share my screen. So the subcommittee started walking through the language, the program description. We started walking through. They were able to change some language in this first part, primarily just to. And Angela has one of these that has highlights that shows where we made changes. We basically talked through the first section. We added more specific language about culturally specific programs. We modified some language. Dharma and Blue and others were a part of this. Did you guys want to weigh in on kind of what we talked about?
I can share the highlighted version if you want.
Okay,
Ron.
great. That'd be great. I'll stop sharing
Okay.
because I don't have that one.
You might have it too. I think Angela sent it out to folks.
Okay.
But I think there was just some adjustments
Yeah.
in the language here. I believe it said before to better serve people with a substance use disorder. And the adjustment was to better serve people actively using substances or having a substance use disorder in this first section. And this was just pulled from like SB 755 is my understanding. The other changes that we made here was the inclusion in the goals of the burn grants was to establish the burns per county. And then I think Ron had recommended that we add recovery housing here just to be more specific. And then I think there was some confusion about, and initially the document had said to increase the workforce, the behavioral workforce capacity, but that felt like it was something that would fall under the access to care grants as opposed to the burn development. So we clarified that it was to build capacity to establish burns, including workforce expansion, and then technical assistance, including but not limited to building capacity for culturally responsive services, increasing culturally specific services, metrics collection, program compliance, and reporting. The grant eligibility here, this is pulled from the temporary rules. And I think the big changes, the only changes here that we added from what we initially had in here was that we added in some information about the MOUs for referrals and sharing duties, that they should be established between the partners of the burns prior to distribution of the grant funding from OAC. I think that's a little bit different than maybe what we had initially discussed. Right now, I think in the temporary rules, it just indicates that at some specified time period specified by OHA, that they'll need to have an MOU. But what we put into the RFGP here is that they'll need to, that they don't need to have the MOU established before applying, but that the funding is contingent on the establishment, the funding being distributed is contingent on establishing the MOU. And then this last part that Angela touched on before, that's a big change from what we discussed maybe in council, was that OAC and OHA could work in tandem to develop some mapping policies or some baseline policies that we could offer to them. And a big reason for that was like kind of an equity piece where smaller regions may not have the capacity to develop all of these policies. And if we have this big long list of policies, which are all very important, it may scare people away from applying for the grants if they don't have some guidance on how it would look like to provide some of these services or what the policies might look like that would be the most inclusive. And so by us providing a template, it makes it more accessible, but also can help us be more involved in the development of those policies at the most inclusive level. I don't know if there's other things from here. I wasn't in the meeting today, Ron, so I don't know if you have more from today's meeting that was changed.
Yeah, the only thing that we really added today was we from the one that, and that's the one I don't have, is the one from today. And that's where we added the language from Senate Bill 755 into the allowable activities under the grant. And so that section is missing from this particular one, but it essentially takes, oh, there, wait, is that it? Yes, there it is. So network must have the capacity to provide the following services, and it lays out specifically what the services are. That's what wasn't in there before and is, and it comes, and this language comes directly from the law. However, we feel that, you know, it's a little wonky, and so we can like modify it so that it can either be bullets or paraphrase or paragraphs to give kind of a better kind of sense of what it is that we're asking them to do. Because the legislative language, you know, can be a little wonky and cumbersome, hard to understand. And so that was kind of the major thing. And then the questions that the council has to deal with, you know, whether we are going to, for grants or contracts, how much funding per burn, how are we going to come up with those numbers? That's a conversation that the council needs to have. And when we still haven't decided when we're going to have that conversation, but I think we would need some sort of kind of financial parameters from OHA in terms of the status of the account, how those accounts work. Can we assume all the money's in there at the beginning of the cycle? And, you know, would it be better to do, you know, how is that money allocated to the organizations? Is it a lump sum up front? Is it quarterly? Is it annual? How does that work? And we need more information from OHA on how the financing of the programs work, I think, in order to be able to make these decisions. And that's pretty much the update.
I think I have one other question for OHA maybe is, so when we develop the temporary rules that currently, as it's written, it seems to indicate that that there needs to be an MOU or at least maybe a funding agreements between individual service providers that might indicate that they need to be working together. If there's multiple burns per region, do they need to have an MOU between multiple burns? Or if a funding applicant is only seeking to provide one service and doesn't seek to work in like a basically coordinated care with other organizations in their burn, do they need to have an MOU?
And there was one more thing that I was trying to, sorry, I got sidetracked. Go ahead. Oh, the thing that I just reminded myself of what it is. The other element is that we're making changes in the grant to make more sense for the application process. And so because some of that language is in the temporary rules, in order for the temporary rules to match the grant process, we have to open up the temporary rules to modify them. That was the other thing. And so
yes, I can respond to that part of the question and say yes.
Okay.
That when we have the RFP process, and that was one of the questions that we talked with Allison and Angela and I and kind of the rules coordinator team that we had together. It seems like yesterday, but maybe it's a couple of days ago. That depending on what is determined, and this is my first time seeing the RFP, so I would love a copy to kind of make sure our rules are in alignment when it's ready to go, but make sure that we're not saying one thing in the rule and not allowing for the RFP process to go forward. A lot of the times we do include it in rule, kind of point to the RFP.
yeah, it may be likely that next week we would likely, depending on what the other tri-chairs and the staff think, we may be opening up the rules next week. We've been wanting to do that for a couple weeks now, but so maybe we'll just slate it for next week.
Yeah, that might be a good idea.
Who would be a good person that I can forward the documents I received today to get those to everyone on the council? I have this like highlighted copy of the
You got one
rules we've
today?
worked on so far, and then we have an evaluation and analysis matrix as well that was sent to me. I don't think it was sent to all the council members. So who can I forward that information to?
I'm happy if you send me things, I'm happy to send those to the council.
Thank you, Brandy. Blue has a hand up, Blue.
Yeah, I was actually thinking about this earlier in the subcommittee, but would it be possible for somebody, maybe OHA has somebody or knows of somebody that could lower the literacy level on the application once we get sort of the meanings? It's really high literacy level right now, and I feel like it could be brought down a lot so that it could be more accessible to a lot of people, especially, you know, new and different organizations that are just starting out. I just want to make sure that it's accessible and understandable to anybody that wants funding.
Thank you, Blue.
Thank you, Blue. I talk about literacy levels a lot in my work. Yeah, thank you for that.
Well, that concludes the update. Thank you, Dharma.
All right, so.
Oh, Keisha, we have a hand. Caroline, do you have something on that before we move on?
Yes. I apologize for disappearing, but we have an outbreak with COVID from the funeral that unfortunately our folks attended. So we have a major outbreak. We've had more than 20 cases within the last 24 hours. So if you keep seeing me disappear, I'm taking phone calls. But I did, so I'm working from home. So, because my office too, had to close for 2 positives in my building. So I read this morning, I think after Angela sent it. And every time we write a grant, or anytime we put an RFP together, we have to pretend that we're filling it out. If we can't fill it out, then we have not hit our target. So thank you for the feedback to number 1, to reduce the literacy rate. And there is a program on Words, or there used to be, darn. Hold on a sec. Okay, so I know that this was the first stab at it, but I think we have to make sure that when we put too many questions on here, we're going to make people not want to fill this out because it's too complicated. So we really need to put in there, there's a lot of questions in there saying, what's your philosophy? You know, are you ready to do this? You're ready to do that? But yet, this is probably some of the Burns' first attempt of putting something like this together. They're not going to be able to respond to that because it makes it look like you really have to have a lot of experience in order to get this particular Burns. So I think we need to determine if that's what our goal is. Are we trying to establish brand new? This is brand new to many folks. I'm just kind of concerned in terms of the disconnect, in terms of the flow. Also, that if this is going to be Burns, you think our question should be around what is required with the Burns, and the policy should come somewhere in between. But when I look at all what needs to be in the policy, I mean, it's just overwhelming. So I'm not sure how we're going to get all this done in order for it to be announced by October 1st. Isn't that the goal? I'm not sure how we're all going to get there. And I really wanted to be on the call this morning, but I could not because of the crisis. So I'm just throwing out thoughts. I'm not expecting an answer. I'm just throwing out thoughts because I just finished reading as a grant reader for the Department of Justice. And some of them were so miserable for me to read because they just did not follow the questions. And there's no way I could give them points. And I felt real bad because I know there was a definite need. But when you try to come up with criteria and it's not there, you can't give them points. And so we need to take that in consideration in terms of how we're going to score these, because we might be leaving people out who really should maybe become a burn, but we made the application, the RFP, too complicated where they couldn't get the points that's needed. So I'm not sure how else, I don't know. Maybe I'm just overwhelmed with just reading this whole thing just now. So that's it.
Thank you, Caroline. Dharma, did I see your hand up?
Yeah, and I was gonna say that I know that in the first grant subcommittee meeting, we had talked about like putting in word limits and different things, keep it condensed and to keep it more simple. And that, you know, I think that we could, I guess I'm wondering too, if with these webinars and things, I think that should help with the accessibility of the applications, but I think we'll need to make it clear when and where those are happening, so that folks can get the assistance that they need in applying. But I also think that condensing it down with the word limits will help to keep it simple for folks who don't have as much experience writing the proposals. But I wonder too, if we can do things like adding in a definition section to our RFGP that can help with folks' understanding of what we're asking for, especially considering this is new to so many service areas in the state.
All right, thank you. I don't see any more hands, and we're getting a little bit in the weeds, less process and more of the nitty-gritty in that conversation. But I will turn it back over to Keisha unless there's anything more on this subcommittee process. I want to make sure you all have enough time in executive session today. All right, Keisha.
All right. So we're about to go into executive session. The Oversight and Accountability Council will now meet in executive session pursuant to ORS 192.6602F, which allows the council to meet in executive session to discuss attorney-client privileged legal advice and discuss documents that are confidential with the Oregon Department of Justice. Sorry. Representatives of the news, media, and designated staff shall be allowed to attend the executive session. All other members of the audience will remain in the live stream portion of the meeting while the executive session is held in a separate breakout room. Representatives of the news media are specifically directed not to report on or otherwise disclose anything said about these subjects during the executive session, except to state the general subject of the session as previously announced. No decision may be made in executive session. At the end of the executive session, we will return to the live stream and resume the public portion of today's meeting.
Thank you, Keisha.
Waiting for breakout room?
Yeah, this will be happening automatically here in a sec.
It didn't put me in a breakout room.
Have you seen my card?
I'm not in the breakout room either.
Hey, I don't know what they did for us.
What does it do, buddy?
Unless we're in a breakout room together.
I'll show you.
Oh, there's 13 people on this one.
You see before, that's what you need to do. Yeah, so you have to do that. You have